I'm Dr. Ginny Kress-Parrott. I am one of the behavioral health faculty here at the Alaska Family Medicine Residency. Born and raised in Alaska, my parents made that decision for me, and I have grown up in this town, specifically Anchorage. So our residents come to us and have the opportunity to practice in a patient-centered medical home. And what that means is that all of our residents gain experience working with our interdisciplinary care team, which includes our RN case managers, our patient navigators, social work, pharmacy, and then working very closely with their CMAs to be able to provide and address patients' needs. So as part of our integrated behavioral health services, we're fortunate because we're actually one of the sites for the Alaska Psychology Internship Consortium. And so we have doctoral level interns that come to us for a 12-month period of time that train alongside our residents. And as part of that, we're able to offer a number of different integrated behavioral health services. And so we offer psychotherapy to our patients. And then we also offer a briefer model of psychotherapy that's more focused in on addressing and meeting the needs of patients more directly. And then we also have behavioral health consultation, where there is a behavioral health provider that's able to go into the medical appointments and address patients' needs there. We're also able to do psychological assessment and testing for our patients, so things like adult ADHD, some cognitive testing, and also diagnosis differentials. All of our residents have access to our psychiatric consultant. And so they are able to train alongside and learn from a psychiatrist that thoroughly enjoys teaching family medicine residents. And then they're able to kind of hone in on their psychopharmacology skills and become a lot more comfortable with that class of medications. Additional subspecialty services, behavioral subspecialty services that we offer is our chronic pain management. So we actually do a chronic pain needs assessment, as well as that includes an opioid risk stratification. And our residents learn specific behavioral health techniques for managing chronic pain. Then we also have a focus on our perinatal and postnatal period, since we do full spectrum here. And we do an OB psychosocial intake for all of our OB patients, and our residents receive additional training in perinatal mood and anxiety disorders. One thing that our residents really enjoy partaking in is our medical group visits. So we work closely with our RN case managers to be able to deliver medical group visits for diabetes as well as chronic pain. And then our residents also receive additional training in geriatrics. And our geriatric patient population is rather robust at our clinic. And so they become comfortable with doing cognitive screenings as well as screening for geriatric depression. In one subpopulation that we have the privilege of being able to work and serve is our refugee population. And so our residents gain exposure with doing physicals for our newly resettled refugees 30 days within arriving in Anchorage. And then they are able to gain additional training and experience becoming familiar with what are some of the mental health and behavioral health concerns that our refugees face whenever they come into our community. And so it tends to be a very nice holistic way of being able to serve our refugee patient population as a whole. One thing that I just absolutely enjoy teaching residents is they keep us all on our toes in terms of our knowledge base and staying fresh and new and kind of knowing what the latest and greatest is. And our residents are fun to teach. We enjoy teaching them. And I would say that specifically for me, I just really enjoy teaching different behavioral health techniques that can help with chronic disease management specifically. Resident wellness is very near and dear to all faculty members' hearts. So that is something that we strive to be able to look at so that our residents do stay well through the course of their residency training experience, while continuing to have robust and rigor training opportunities that make them full scope family medicine doctors. And so as behavioral health faculty, we oversee the resident wellness curriculum. And what that means is that we work closely with residents to be able to have a pulse for what is wellness for each class. We have resident wellness advocates that help to be able to be a liaison between faculty and residency classes about what is the need and what are some different things that we can be doing to be able to elicit and increase residency wellness as a whole.